Okay, so today I'm going to be inserting an IV. Before I go in my room, I just want to make sure I have all the equipment that I need. I have a normal saline syringe. I have the needle. I have a 20 gauge needle that's 1 inch. I have the IV starter kit and a pair of gloves. Alright, so I'm going to go in my room, I knock on the door, introduce myself to my patient. I'm going to have them state their name and date of birth to make sure I have the right patient. I'm going to let them know what I'm doing. I'm going to be inserting an IV. I'm going to let them know why we need to give them some extra fluid. They're a little dehydrated. I'm going to set myself down on the table real fast. I'm going to go wash my hands. So my hands are nice and clean. I'm going to grab a sterile field. We're going to use this for my sterile field. Place it on the table. I'm going to unwrap my normal saline from its packet. I'm just going to set right there. I'm going to open up my needle and my gauge. And this up here. I'm going to open up my starter kit. So this is going to have my Trinigate. It's going to have my dressing, my alcohol swab, and some gauze. I'm just going to place this. Okay, and then my banana we are going to use for my patient's arm. So I'm going to have him place his arm down, pendant. So I'm going to use his forearm. I'm going to try to avoid the AC just because when people bend it, you're at a higher risk of bending the plastic piece of your needle and it could come off. So I'm going to go in the forearm. So like I said, that's his arm. I'm going to place my gloves on. I'm going to grab my adapter. And just to open this real fast, I'm going to grab my normal saline syringe, take the cap off, and I'm going to insert it into here. So that way, once I have my IV plates, it's all ready to go. I'm just going to flush it a little bit just to make sure that the fluid's in there. A couple of drips. So that adapter is flushed and ready to go. I'm going to set this back in my normal or on my sterile field. Put that in the trash. And grab my Trinigate. So I'm going to go above the AC if this was his arm, so that way his veins down his forearm will pop up. When I replace this, I do want to make sure I make it tight enough so the veins are popped out, but not too tight where it's hurting my patient. So I'm just going to have my finger underneath to kind of like tie a little knot underneath. Okay, so something like this. So when I'm done, I can easily pull that off with just one hand. So I'm going to use this line as my vein. So I'm going to palpate, feel for my vein. I'm not just going to go for looks because sometimes you can't see the vein, but you can feel it. So I'm going to feel around and I feel that vein. So I'm going to go right there. I'm going to take either an alcohol swab or you can do a little chlorhexidine wand. So I would crack that, make sure the solution comes down, and I'm going to clean my vein in a circular motion, and I want to make sure I go 2 inches all the way out. So that is nice and clean. Put that down. So I have my IV. I want to make sure that this is clamped before I insert it. Take the plastic off. I want to make sure the bevel is up. I'm going to make sure I have the skin taut, I have it pulled down, so when I insert the needle, the vein won't move or roll. So when I insert, I want to make sure that I'm going at a 15 to 25 degree angle. So like I said, I'm going to have this pulled down. I'm going to insert my needle. Okay. And when I get a flashback, I'm going to stop. I'm going to stop right there. I'm going to hold the steel. And then I'm going to insert just the plastic, but I'm going to keep this steel needle out. At this time, I'm going to have blood backflow all the way up to the, okay, I'm going to undo my tourniquet, like I said, one finger undone. I'm going to take my end, pull my needle all the way out. So right now we got blood. I'm going to unclamp this so my blood will be flowing through my whole tube, but I won't. Going to put my adapter on. I'm going to flush a little bit of saline in there, and I'm also going to draw back to make sure that my IV is in there correct. And I'm going to flush it again. Going to clamp. I'm going to feel around my IV site to make sure that it's not blown. My vein did not blow. Ask my patient if it hurts or anything, if it's tendered. Okay, so we are good. I am just going to take like a skin protector to help make the skin a little bit stickier. So when I put the dressing on, it does stick better. I'm just going to take this, go around the skin, also wipe off all the blood. I'm going to let that air dry, make sure you don't fan. And then I'm going to take my dressing, I'm going to go over my IV. Put my IV in the slit. So I have that on. And then that's how you insert an IV. Then I'm going to make sure that I document in the correct format. I'm going to document date and time, how many attempts it took me, if it took me 1 attempt, 2 or 3 attempts. I'm going to document the size of the gauge and the length of it. I'm going to document where I put the IV at, put it in the left forearm, and I'm going to state what I'm using the IV for, what I'm flushing it for, and how the patient tolerated it. Right. And then I make sure that I'm also going to date and time my dressing, so that way people do know. And then clean up my mess.